Helen?
Well, for those of you who aren't very familiar with Kaiser Permanente, we are the largest nonprofit health plan in the United States and are enjoying coming up on 60 years presence in San Francisco. Our unique organizational structure, which combines the nonprofit health plan with a physician-driven medical group that sets both the coverage determinations as well as the clinical practice standards, has achieved unprecedented clinical outcomes for our members. But we aren't just concerned about Kaiser Permanente members. We're deeply concerned about access to health care broadly across the United States and in San Francisco County. To that end, we have endorsed universal access to health care and are working both at the federal and state levels to encourage our policymakers to achieve that outcome for all of us. We believe that there are several components, though, that have to be critical elements of any healthcare reform. Access can't be defined exclusively as access to hospital services. We really need to make sure that we attend to preventive and chronic conditions management. As we've already talked about, chronic conditions really represent the major cost and opportunity for healthcare reform. Financing reform needs to focus not just on paying providers, whether they be medical groups or hospitals, for the services they provide, but paying them for the quality of the outcomes they achieve. We have perverse incentives right now in our healthcare financing in the United States that pay providers for the volume of what they do, but not the outcome of what they do. Care delivery also needs to be changed so that we have the right care being provided in the right venue. And we believe that an integrated electronic healthcare record is an underpinning for success with that. And we are proud of our Kaiser Permanente Health Connect, which links all of our providers, our members, and our hospitals in a single integrated system. Lastly, and maybe most importantly, we need to address the root causes of our health status problems. And these include the environmental and behavioral issues that largely are unaddressed. 70% of what determines how healthy an individual is are these causes, and yet we spend less than 4% of our federal dollars on those aspects of poverty, violence, absence of nutrition. Because it's an imperfect world we're living in right now, and these ideal goals that we all are aspiring to aren't yet achieved, we are committed to support our community through our community benefit program. And in San Francisco, Kaiser Permanente contributed more than $16 million in direct grants to some of our fellow nonprofit organizations, partnered with our safety net communities, both in providing funding and in-kind professional support, so that we can realize a short-term progress in improving the health of our communities. We are delighted to be a new participant in Healthy San Francisco, and on July 1st, we'll begin enrolling the first of our 3,000 San Franciscans who will find their medical home at Kaiser Permanente San Francisco. We look forward to a future that is cautiously optimistic, sharing our partnerships across the private and public sectors to assure that all San Franciscans have access to high-quality, affordable care. Thank you.